My name's Sophie. I am a project officer and I work on the Digital Hospital Program, and we're here today to talk about the Business Continuity Plan. Has anyone heard at all about the Business Continuity Plan, or the BCP as it might be known? No, not so much? In a simpler term, it's a big plan. It's about 50 or 60 pages that talks us through what do we do in an IEMR downtime. So what do we do if there is a planned downtime of the Cerner modules or if there's an unplanned downtime? It also talks about, if a connecting module that's connected to the Cerner modules fails. So for example, Hibiscus, how will that affect our IEMR, and how do we continue to work through our work processes without those modules? So in today's session, it'll be about 15-20 minutes, and it is a quick overview of the BCP itself. If you have any questions that I haven't covered in the session, please just raise your hand or come up and have a chat after the session. We'll also talk about the 724 Downtime Viewer. Some of you might have already seen them being installed throughout the hospital. They're a white cabinet on the wall which contain a laptop inside, so we'll have a chat about them. We'll talk about what's available in a 724 Downtime Viewer and what isn't available. We'll do a live demo of one of the Downtime Viewers up on the screen, and I'll also walk you through the Downtime Kits, which will be co-located with each Downtime Viewer. So for starters, as I said, what is the Business Continuity Plan? It's a plan that will focus on how do we continue to care for our patients when we're not relying on electronic medical records. So as I said, this could be in a planned downtime. For example, over the next couple of years, the modules are going to need enhancement. So this may be a 15-minute planned downtime in the middle of the night, or there may be a situation that we can't control and the systems go down for an unplanned reason. So what do we do in those situations? How do we prepare for that if it's planned? And also, what do we do when the systems come back up? So if the system's been down for half an hour, how do we recover? If the system's been down for 4 hours, how do we recover? So the BCP talks through that. It also talks about the communication channel. So an unplanned downtime is classed as a code yellow, so an internal hospital emergency. So the call will come down from the executive level that a code yellow has occurred and the IEMR is currently not available, and the BCP will be rolled back on, and you'll be instructed to follow the work processes aligned with the BCP. As I said, it also looks at the recovery paper forms within a downtime. If you've been down for 4 hours, the BCP walks you through what do you do with those records after the system's back up. Do we scan them? Do we directly enter? All of those things are covered within the BCP. The 724 Downtime Viewer, as I said, is a white cabinet, a secure cabinet that's located on the wall. There are 75 throughout the campus, including Mater Radiation Oncology and Burke Street. So they're a physically locked cabinet, and the keys will be kept with a senior member of staff on shift, so either the NUM or the CNC. So we'll have a look at what is actually in a Downtime Viewer. So basically the Downtime Viewer is a laptop within the cabinet. When opened, it looks very similar to a computer screen. You won't be able to tell the difference, and it is a read-only version of your electronic medical records. So you aren't able to enter information into the system, but you are able to view the information that was in the electronic medical chart. Some of the things that are available in the 724 Downtime Viewers are patient demographics. So the Downtime Viewers can hold up to 30 days of information. So information entered into the IEMR before that 30-day mark won't be able to be seen during a downtime. This may be an issue for outpatient departments, especially if there's a length of time between appointments. If the information you need to access is past that 30-day point, it's a decision about whether you can postpone the appointment until the system's back up, if it's for a short period of time, or if the decision may need to be made to reschedule the appointment until the system is back up and you can access that information. Allergies and problems, another really important one. With the patient demographics, next of kin details are also available, which is really important. Orders, scheduled appointments, past and future. Results from radiology and pathology, progress notes, vital signs, intake and output, and patient lists. So you're able to sort in the Downtime Viewer a list of patients based on your location. There are a couple of things that aren't available in the Downtime Viewers, so they aren't able to hold scanned images. So any images that have been scanned into the electronic medical record are not available in the Downtime Viewer. This includes PACS images and ECGs. I will just cover with the ECGs though that some critical areas like ICU and cardiology already have processes in place to cover this. So when taking an ECG, they print off the image and keep it in the patient's chart. They will continue to do this and they'll be put in the CEC, the current encounter chart. So if there is a downtime, they still have access to those ECGs. Not all areas will do that. However, for those vital areas, it is quite important. Notes made by clinicians about the reading of the ECG will be in the Downtime Viewer. So it's just the raw image that isn't available. I'll give you a bit of a live run through of what it looks like so you know what I'm talking about. So as I said, if an unplanned downtime is called, a senior member of staff will be notified and that will be distributed throughout the ward that we are in downtime and we need to roll back to BCP procedures. It's then up to the person on staff who has the keys to the Downtime Viewer to unlock the cabinet and open the laptop, and they can log on just like a normal laptop. So this is the screen that will come up. This little icon over here called 724 Access Viewer is the application for the Downtime Viewer. When you click on it, it's going to ask for a username and password. These are a secure username and password specific to the Downtime Viewer, and they'll be kept in your Downtime Kits, which, as I said, are co-located with the Downtime Viewer, and we'll talk about a bit more in a second. So once the nums unlock the cabinet, they've opened the laptop, they've got their password and username, and they've entered it in. This is the initial screen that will show up. It automatically defaults to FirstNet, so the patients we'll look at now are going to be emergency patients. But you'll see across the top that there's also a patient search tab. This will bring up the patients in the rest of the hospital, so all of your inpatient wards. You've also got appointment search, which is really handy for the outpatient departments, because if we have a downtime at 8 o'clock in the morning, they're going to want to know who's coming in the next couple of hours, so you'll be able to search that based on location. We'll run through FirstNet search, so just bearing in mind that this will be the emergency section and there is the patient search section, which is the rest of the hospital. You can filter by name as well. So if you're looking for a specific patient, you can enter their information and it will bring their chart up. When you first try to search someone's information, so I've done this by tracking group, so it's going to bring up the emergency tracking group, it will pop up with this audit information box. This will only happen the first time you search for information. It's not going to happen every time. It's basically just so you type in your Novell ID so we know who's accessing the Downtime Viewer, and it also asks you why you're accessing it. So we've made it really easy by saying that it's most likely a downtime that you're using the Downtime Viewer. As you can see, this is a live feed, but obviously it's not everyone that's in emergency at the moment, but I've just popped in the group and it's pulled up the patients that are in that area. You can print, as I said earlier, a whole patient list. So if you did want to print a list for the whole area that you're in, let's say Ward 2C, you can simply click and highlight the number of patients that you'd like to print, and there's a print list button. When you print list, it's going to have a number of options for you, so you can select what type of information you wish to print. You may only like to print their name, their sex, their chief complaint, and their nurse, for example, or you may like a lot more information in your patient list. So it's completely up to you as to what you print. We'll jump into a patient chart, so that's simply by double-clicking on that person's name. It will then bring up their electronic chart. Over to the left-hand side, as you can see, you've got your patient information, your lab results, patient care results, and so on down the side. So you can go into all of those and it will populate the information that you're looking for. If you'd like to print a specific patient chart, it's simple, it's just the file print button, and then the printer preferences tab will come up. So this is another screen similar to the patient list screen. It's going to ask you the date range that you'd like to print. So as I said, the Downtime Viewers are capable of holding up to 30 days worth of data. If we're in a half an hour downtime, you might not want to print 30 days worth of data for every patient in the ward. So it's up to you about how much information you want to print. We will have recommendations in the BCP though as to what we recommend you print for if we're down for half an hour. Do you just print a patient list? Do you print the vital signs for every patient? But then if we're into a 2-hour downtime, we probably recommend that you print extra documentation. So it's definitely customised to each ward or department, but there will be those recommendations in there for a guideline. So just like printing the patient list, you can select what type of documentation you'd like to print. There is an extensive list, so hopefully the quick reference guides will be handy for you. And it's simply just clicking what you'd like to print, making sure you've got the date range right if you only want the previous 24 hours or 2 days, and then clicking finish. If we jump back to the patient list, you can also print multiple patient charts at the time. So if you wanted to print all of the vital signs for the whole ward, you don't have to go into every specific patient. You can do as we did when we were printing a whole list and click the print chart button. Again, it'll ask you what information about the charts you want to print, and you can click finish and it'll populate those charts for you. Each Downtime Viewer is hardwired to a printer. So in each area, you will have a printer that has a sticker on it that notifies itself as a Downtime Viewer printer. So when the network is up, they will be wirelessly connected, but if the network is down, they are hardwired through the wall with a USB cable, so you'll still be able to print. The Downtime Viewers are also on UPS power, so they're on the uninterruptible power supply. So if the power is out, the backup generators will kick in and the Downtime Viewers are supplied by that. They're also a laptop, so if worst case scenario, they run on a battery pack which will last you 4 to 8 hours. So that's a really quick look at the Downtime Viewer. It's obviously a very extensive tool, and there is one available in the practice lab if anyone wants to have a fiddle. When we distribute the Downtime Kits, which I'm going to talk about now, I will, myself and my co-worker will also walk the lead person in that area through the Downtime Viewer and the kit, so they know exactly how to work it. So as I said, there will be Downtime Kits co-located with each Downtime Viewer. They're literally a plastic box. So they might not be right next to the viewer, but they will be in very close proximity in the ward, so maybe in an office or in a cabinet. And in those boxes are everything that you will need to get you through downtime. So you'll have all of your read-only copies on your Downtime Viewer. In your Downtime Kit, you'll have spare patient wristbands, you'll have spare patient labels, specimen labels, all of the paper forms that you'll need to get you through, so you'll have to resort back to paper. We've also thought of pens, because now we're going digital, they might be a bit scarce, so we've put some pens in there for you. We've also got the quick reference guide, so we just had a really quick go through of the Downtime Viewer, but we do have a quick reference guide which will walk you through exactly how to get the patient information that you need. As I said, you can sort by location in the Downtime Viewer. Location is sorted by the ward hibiscus code. Now, some of you might know your hibiscus code, but it is a little bit tricky, so we've included a quick reference guide in the packs as well. So it's quite a big booklet that literally lists all of the hibiscus code and what area they correlate to. So you can have a look and see what area your code has and enter it into the viewer, and that way you can sort by your location. In the Downtime Kits as well, as I mentioned, there will be the password and the username. So there'll be a secure box. So in the event of a downtime, the NUM will be notified, or whoever the senior member is. They'll be able to access their kit, crack it open, get their password and username, unlock their Downtime Viewer and access it.